Good morning to you all. So today we start the first chapter in diagnostic microbiology. Okay. Chapter is specimen management. This is the textbook. It's Bailey and Scott's Diagnostic Microbiology. And this textbook is considered one of the best textbooks in diagnostic microbiology. But there are others. There are many others. Lippincott, I don't know, many others. But this is the one which is good for students. Nowadays, we have the 15th edition is out. I think 2021, 2022. And we had the 14th, which is 2017. You can use either of which. Both are okay. Because the difference between edition 14 and edition 15 is slight. Maybe does not exceed 5%, not more. And all the new modifications and new additions, I will just point out to them. And I will tell you this is something new, this is important, because some of the modifications, they are not very important. Yes, they are subspecies of the bacteria, which we are not very much interested in. So you can use 15 if you like, you can buy it from Amazon, or you can use 14, it will do. On my YouTube channel, you will have a playlist of almost 14 chapters from the 14th edition. I have started a new playlist from the 15th edition. Once we finish, every time we finish a new chapter, I will make it public. Still, this chapter, for instance, is still made private. So this is the main one. If you have 15, it's okay. If you have 14, it's also okay. So here we have, by the end of this chapter, as a student, you will be able to tell the following. State 4 critical parameters in specimen management. We have parameters. Identify a proper labeling practice. You have to label the specimen. You cannot leave specimen just like this. Sometimes at home you have to label. In your kitchen, you have to label, yes? Maybe the spices and everything, it had to be labeled. Maybe from the side and from the top. So how about in the lab? It's even more critical. And in the hospital, you have to label things. Define culture media. As you had in the basic microbiology, every bacteria is cultured or cultivated on a plate. And these plates, they differ. We have tens and hundreds of plates because each company has a panel of plates. Okay, blood agar, chocolate agar, EMB, McConkey, and many others. Describe oxygenation states. Some bacteria, they like to, or they live on oxygen only, strict aerobes. Some, they live oxygen or without oxygen, it's okay. Some of them, very small amount of oxygen. Some of them, they need carbon, carbenophilic. Some of them, anaerobic. They don't like oxygen because if oxygen comes, they become toxified and they die. So the oxygenation states is very important in bacteria. Determine rejection rule. When to reject a sample. You have somebody referred a sample to you. Sometimes this sample is not labeled. Sometimes it's leaky. It leaks out. And many other things. When to reject a sample and how to reject it. Can we just say, this sample is not okay, throw it away, we need a new one. Sometimes it's not easy to get a sample. It's not easy. Yeah? It is a tissue or a biopsy. You cannot just throw it like this. You have to make consultation before you take the decision. And list critical parameters of reporting, or we call it panic values. In certain instances, you might see a result that is incompatible with life. Let's say you have sugar, glucose. In the lab, if you see glucose 10, that's impossible because nobody has glucose value of 10. Or if you see it 60, then this is a panic value. You know what panic means? Panic means frightened. Panic value, the value that makes you afraid, because the patient might die. So if you see somebody with the glucose level less than 70, you have to make this as a panic value. If you isolate a bacteria like Bacillus anthracis or Vibrio cholera, this is a panic value or a panic bacteria. You cannot just go over it just like this. You have to report. So what are the panic values in microbiology? So these here, the objectives. General concepts of specimen collection and handling. Appropriate collection techniques. So usually the samples in microbiology, and not only in microbiology, but even also in other like serology or immunology, you take the sample when the patient is at acute phase, at the peak of the disease, so that you can get or you can easily isolate the bacteria or the pathogen. The same thing for serology. When you are at the peak of your symptoms, acute phase we call it, you take the samples. Not after antibiotics, for instance, and before medication. You never take the urine sample 2 or 3 days after medication, after giving antibiotics to the patient. Just before, because at the end, then you might not be able to isolate the pathogen, E. coli, for instance, if there's antibiotics 1 or 2 days. So here, specimen collection instructions. These instructions to nurses and clinicians. Why? Here they are talking about hospital. And in the hospital, as a medical technologist, you are not alone. You have other members of the medical team, physician, nurse, X-ray, and so on. But you are going to deal mainly with two, the nurse and the physician, the doctor. So these instructions for, let's say, collecting samples, you have to have them better written, and maybe in the nursing ward and to the clinicians so that they can read. And instructions are not given verbally. Maybe they are stressed verbally. You say them verbally, but then at the end, they should be written as instructions, or written instructions, we call them. Safety regulations. What do I mean by safety? If you are dealing with samples, you should have gloves on. Maybe this sample, this bacteria, is the mode of transmission is airborne. So you have to have a glove, mask, maybe, lab coat. Let's say many of these safety precautions, they should be taken into consideration. Otherwise, you might get yourself infected. Okay, so safety regulations very important. Not only for collecting, this is a hospital, and safety regulations in hospitals are taken as top priority. Select site and specimen. You need urine culture. We know if we say urine culture, we know that we should take urine cup, sterile, this is sterile, and we take urine, not stool. We take not sputum, for instance. And the specimen is urine. So every time you have a request from the doctor, the physician, let's say swab culture or the throat culture or sputum culture, you have to know, and the clinician and the nurse, they up in the world, they have to know that here we need sputum, here we need throat swab, here we need CSF, here we need urine. So type of specimen and the site, where to collect from. Type of swab and transport medium. Sometimes the time between collecting sample and processing the sample, the time is long. Maybe 1 hour, less, more. So what should we do? Just keep the sample. We take the sample from the patient and keep it on the table or on the shelf for 3-4 hours, then the bacteria will die. So there are also transport media for this. A media in which you put the sample and it can stay 2, 3, 4 hours. It can tolerate delay. You know what delay means. It can tolerate delay. So there are swabs, cotton swabs, just direct, and there are swabs that have gel inside them. Gel inside them, and this is transport media. You put it and then Maybe in your lab, you don't do these tests. They are special tests. You want to refer them to the city or somewhere closer or to another reference lab. The reference lab may be 2, 3 hours drive. So you have to have transport media so that you can keep it as long as possible. Transportation, time, and temperature. If you want to, if you want to deliver the samples, then you have to know that which is the best temperature. The time, okay, we have a time, maybe it's 1 hour or 2 hours. But if you have transport media, it can stay for 6 hours, sometimes 24 hours. Okay, but the temperature, if you are going from one place to another and the temperature outside is 40, then this is a problem. Maybe you have to put it in a cool place. You have a cooler in your car. Sometimes you deliver DNA, and DNA should be delivered frozen state, -20. So either you have ice blocks inside a small freezer, or there is a freezer which you can put in your car. Yeah, and then just when you switch the car on, this freezer works, and it keeps everything -20 for as long as the car is on. So you have to take these into consideration. And some people, they don't care, and they are careless that they don't take these things into consideration. But these pre-analytical circumstances, pre-analytical variables, they affect the results. If you keep you are a patient, and I took the sample from you, and you went home, but do you know what the laboratory or the lab technician did? Maybe he just threw your sample on the table, on the bench, for 4 hours, 5 hours. You don't know this. But some people, they are not careful, and they are careless, and it becomes a habit of life to leave things on the bench for as long as they are left. This should not be your style of working. You should take care of the sample. Temperature, time, all of these affect your results. Okay. Labeling instructions. You should ask the nurse and the physician to label. You know what to label? To write the name and the code on the urine cup or the swab. Nowadays, we have everything, the barcode reading. The barcode, the barcode in the supermarkets, you just have a label, and this label. Also, people have barcode reading. So when you read it on the laptop or on your computer, everything appears. The person, the address, the phone number, everything, all details, demography, and even clinical. But some people also insist to have not only barcode on the urine cup, the sample, barcode plus at least 1 or 2 things, maybe the number and the name, 2, 3 things, so that I can just look and I don't have to read it again by the barcode reader. So nowadays we have this and that together on a small piece of paper, and just sticks very hard. Okay, sticks very hard. So labeling is very important. Imagine that you have a sample or a specimen, and it doesn't have any label. What would you do? Don't throw it, but contact the person and say, this is unlabeled. Whose sample is this? And labeling is very important in the lab, in the hospital. And the labeling is even important in your house. Many times in your house, you have to label things. Otherwise, you don't know what they are, even in your house. Okay, and what they are for. Patient preparation. You have to prepare patients. Maybe it's sputum culture. Tell the patient, for instance, you have to come early morning. Don't brush your teeth. Don't eat, maybe. And then he or she comes, and just ask him or her to clean their instructions. These instructions and preparations, they are very important. Like glucose, fasting blood sugar, FBS. The patient should come to you 12-hour fast. And the same for microbiology. Yeah? Urine, which is the best urine sample, midstream. The first part of the urine in the toilet, and the midstream in the cup. And clean catch. You have to clean the air, whether a woman, a male or a female. So all of these instructions should be given from you as a lab technician to the patient. Or if you are in a hospital, it should be given to the nurse and the clinician. And not verbally, verbally plus written. So that every time they want to, let's say they want to collect a sample for a certain thing like urine, they just read. So very important is to prepare sterile, non-sterile collection. Let's do devices. Let's say you are going to make urine culture, which is the most common sample. You have to ask the patient. You have to give the patient sterile urine cup, not the normal urine cup. Sterile one, not open. And you have to give also instructions. Clean well, midstream, clean catch, all these instructions. And give him or her one cup and tell him don't open it until you want to put the sample in. And the swab. There are swabs that are non-sterile, normal swabs. Don't use them. You have to use swabs that are sterile for culture. Specimen quantity and quality. In urine culture, well, at least you have to give 10, 15 ml. If you give me 1 ml, it's not enough. Maybe it can work if the infection is very heavy infection. But normally 1 ml is not enough, or 2 ml. So you have to give enough sample. Okay, that's very important. And the quality of sample. What do I mean by the quality? If you come to make urine culture in the middle of the day at 12 or 1 o'clock, and you have been in the toilet since the morning 2, 3 times, then the urine will be diluted. And then the bacteria will be diluted, and the probability to get the bacteria becomes very low. Best is the morning one, morning specimen. That's the quality. You will get a good one and clean. Because if it's not clean, then you will get bacteria that is not pathogenic, but the one on the skin, like epidermidis, staph epidermidis, if you remember. Okay, so specimen quantity and quality. I need enough sample or enough specimen so that I can work. Not only just a small portion of a specimen. Specimen transport. Look, transport within 2 hours. But here I must say something. That in the 15th edition of this book, they said that the urine should be transported within half an hour. That's what they said. They made the time gap or the time window smaller. Almost most of them, less than 2 hours. In the 14th edition, it was less than 2 hours for all samples. In the 15th editions, less or equal to. And the urine was down to half an hour. This is one of the major differences between 15th and 14th edition. Leak-proof containers. Don't give me urine cups or tubes or swabs that are broken and they leak. You know what they leak? They spill out. They have a small hole on the side and urine leaks out. So after 1 hour, you will have no urine in the cup, or it's leaky. And when it's leaky and put in a, let's say in a small bag, all the urine will go in the bag and becomes contaminated. So this is very important. Leak proof. Leak proof, it's not broken. Transportation in a biohazard bag. If let's say you have a specimen, swab, you have to have this bag, which is also very strong, and it has the sign. You know this sign? This is an international sign that indicates there is biological material, and this biological material is very dangerous. This is what we call biohazard. Hazard means danger. Hazard means risk. So every time you have a swab, don't just give the swab to the transportation and no, put the swab inside this bag and seal the bag. Close it tightly because the bag from this side here is sealable. You can just close it like this. Just press it and it will close. So if there is any leak, it will leak inside the bag, not on the, let's say, on the seats of the car or in your hand. Yeah. Temperature, pH, and oxygenation should be accounted for. So temperature, if you are, let's say, in a hot area, 40, 42, 45, some areas in the world, in the Middle East, in Iraq, and so it's very hot. So you cannot just take a sample like DNA sample or urine sample and go out in a car without air condition or even without a freezer. So this has to be taken. pH, oxygenation. Yeah. If the let's say if you have the bacteria and the bacteria is very sensitive or labile to oxygen, sensitive, yeah, anaerobic. So you have to keep it all the time anaerobic. All of these things should be taken account for. By the way, many people think that the problem comes from making the test. Most of the problems that come to your result or cause a problem to your result comes from pre-analytical variables like these. Specimen was not taken okay, temperature was not kept, oxygenation was not taken account for. These we call them pre-analytical. These things or problems that face us before doing the analysis. We call them pre-analytical. And in most comes from here. Don't underestimate these pre-analytical conditions. Don't underestimate them. Most of the problems come from them. Specimen transport. Companies, they make swabs and transport media because they know that some labs, they don't make these tests because these tests are special tests. So they manufacture and provide you with, or you have to buy it. They don't provide, you have to buy it with media. Let's say Ames transport medium, aerobic and anaerobic bacteria. Ames transport medium with charcoal. You know charcoal, the black material, coal, COAL. Yes, exactly. So Ames transport medium with charcoal, aerobic and anaerobic bacteria. Why do they use the charcoal, which is the black material, yeah, to neutralize bacterial toxins and maintains pH by absorbing fatty acids? Because the pH, if you leave it, maybe it goes up, yeah, becomes alkaline, and this will destroy the bacteria, or the other way around. So they neutralize the bacterial toxin and they maintain the pH in its status by absorbing the fatty acids. Because at the end, fatty acids are going to be pH, and then pH will go down, becomes acidic. Anaerobic transport medium, anaerobic and microaerophilic bacteria. If you suspect that you are dealing with anaerobic bacteria like Clostridium perfringens, if you suspect that you are dealing with these type of bacteria, then you have to have transport media that keeps the bacteria isolated in an anaerobic media, a media without oxygen. Otherwise, you will not get positive results. Cariblair, that's another media. Enteric bacteria, the bacteria in the intestine, enterobacterials. Okay, 10% formalin. 10% formalin, which we use as a preservative. PVA, polyvinyl alcohol. This is a preservative for parasites. We will talk about this in parasitology. SAF also, sodium acetate, acetic acid formalin. Also, this is a preservative for parasites. EDTA, PVA, polyvinyl alcohol. So these here, this is not one, this is 1, 2, 3, and maybe others also. Gastrointestinal parasites. In our first lab in parasitology or second lab, we will teach you how to prepare these preservatives. 10% formalin, PVA, SAF, there is MIF also, and many others. Stewart's transport medium, also for bacteria. Universal transport medium for chlamydia, mycoplasma, ureaplasma. These here, chlamydia, mycoplasma, and ureaplasma, they are very sensitive and they need special requirements, this bacteria. They don't grow easily. So you need universal transport medium. All of these media, because they want you to have zero problems in pre-analytical phase, zero problem, so that you can get positive culture or correct results. Maybe it's negative. So here we have specimen preservation. Specimen preservation. Boric acid. Boric acid is used to preserve urine. PVA for stool, which we talked about. Preservation. 10% formalin, stool and tissue. 10% formalin, we'll talk about it in details and we'll show you how to prepare it and how to buffer it even. Because 10% formalin alone is good, but 10% buffered formalin, it's excellent. It can extend the life of the parasite. Buffered, see comment. Buffered is much better. We will teach you how to prepare it and how to buffer it. We have two components here. Yes. SPS, this is for blood culture. SPS. Okay, so 0.025 SPS. That's another preservative for blood culture. If you have more than this concentration, see the concentration is very low. Very low. If you have more than this, then it's going to inhibit some bacteria like Neisseria. Heparin, viral cultures. Heparin is anticoagulant. Yes, just you had hematology, heparin, sodium citrate, EDTA. These are the most common. Heparin, and they use heparin mainly for clinical chemistry. EDTA, not used in microbiology. And EDTA is mainly used in hematology. Yeah? ACD is not used in microbiology. It's anticoagulant, citrate, dextrose, ACD. This is used mainly in blood banks, the unit. Yeah, this is anticoagulant in blood banks, anticoagulant in hematology, anticoagulant in chemistry, and there is citrate, but it's not here. 0.025 blood culture. Also, it is an anticoagulant because when you add or inject the blood into the bottle, the culture bottle, if you don't have SPS, then what happens to the blood? Clots, and then everything will fail, will collapse. So they add the SPS. But in this concentration, more than this, it's going to affect your results, mainly for Neisseria, as we said. And the first here, this is for urine, boric acid, PVA, and formalin, and others for stool. And formalin for tissue also can be used. Specimen storage. You have storage from minus 150, we call it liquid nitrogen, 150 minus 196. And then you have the deep freezing, minus 70, minus 70, minus 80, minus 60, this is deep freezing. And then you have the normal freezing, minus 20. And then you have the 0. And then you have the fridge up to 8, from 2 to 8. That's the fridge, the normal fridge. And then you have the room temperature, which is between 20, 25 is room temperature. And then you go up and then it becomes boiling. Some bacteria, thermal bacteria, they live in the springs where it's 100. Yes, where they get the enzyme for the polymerase chain reaction, PCR, Taq polymerase. Yes, Thermus aquaticus. That's a bacteria that lives in the springs. In minus 100 and minus 70, you preserve bacteria. You keep them there. And in minus 200, you can keep the bacteria for years and years, maybe indefinitely, for as long as it's there. In minus 70, maybe you have to refresh or replenish your thing or regrow your bacteria after 3-4 years, maybe maximum 5 years, minus 70 or minus 80. That's deep freezing. So deep freezer, long-term storage, maybe years, months and years, and usually for tissue. Long-term, months and years. But if you are talking about liquid nitrogen, decades. Freezer, short-term, serum serology, maybe 1 week or even more. Not only 1 week, even more. But here it says 1 week. Minus 20. Refrigerator, store for a few days. Sometimes we used to put the urine for a few hours here. Sometimes the DNA, if we want to use the DNA just within a couple of days, we can put it here at refrigeration, which is between 2 and 8. Then room temperature, you can keep the specimen on bench just for a few hours, or mainly all the specimen at room temperature less than 2 hours. In the newer version, the urine less than half an hour. Here, this is general collection information. This is a table in the book, and it's a long table. I cannot give you all the details. If you want to go refer to the table in the book, whether in 14th edition or 15th edition, you can go and have a look at it. I have just made a selection of the samples which I think you will come across very frequently. What I chose here, they represent at least 95% of the samples you will come across during your career life. Okay, we start with urine. So specimen, MSCC, midstream, first portion of the urine in the toilet, and clean catch. Clean the area, and then this is called MCC. Container, sterile, screw cap. Yeah, so nowadays it's all screw cap. You have to screw it 3-4 times until it's properly sealed and closed, and should be sterile. You cannot make urine culture in non-sterile urine cup. That's very obvious. Patient preparation. Clean the. You have to give the, as I told you, you have to give the patient the instructions written. Clean this, do this, come early morning. All of these. Don't underestimate these. What seems to be simple instructions. These simple instructions, they make the difference with you. Transport time, less than 2 hours. Maybe I have to change this. My transport time in urine, half an hour. In this one, in the 15th edition. In the 14th, less than 2 hours. But most of them, less or equal in the 15th edition. In the 14th, it's all less, less. Or 24 hours if preserved. Storage time, 24 hours at room temperature, at fridge. It can stay for 24 hours before culture. The best is to do culture as soon as you can, as soon as possible. Culture media, blood agar, yes, SPA, sheep blood agar, and macaque. This is for urine. Direct examination is that you have to, once you make you just cultivate or culture it on a plate, you have to do 2 things. First, urinalysis, chemical and sediment. So you can look at the chemical and see if it is nitrite positive or leukocyte positive. If it's nitrite positive, then the probability that you'll get a positive culture is very high. If you get leukocyte positive, then also the probability is very high, but nitrite is higher. Okay, this gives you an indication. Nitrite positive, most probably my culture is going to be positive. Few lab technicians do this. Plus take the symptoms. Because with the symptoms and urinalysis, you can make good interpretation of the culture results. And urine is the only specimen. Maybe there is another one, burn, but urine is the only real specimen that you have to make count. On the plate, you have to count. Sometimes you get 1-2 colonies, they are not very significant. But if you get 10-20 colonies, they are significant. So the count plays a role. And this is the only specimen, apart from the burn, but this is the only one that is of significance. So count is very important. Sputum. Sputum, of course, we have many types of sputum, or 2-3 types. Sometimes you have transtracheal. You can just needle and in the chest, and they can aspirate. That's one. But this is very invasive, and very few people use this, if ever. The people use expectorated. To help people expectorate, you have to give them hypotonic saline in the form of mist, mist spray. Put saline, hypotonic saline, in a nebulizer, the nebulizer, the machine, and put it on your face, and just wait for 1, 2, 3 minutes until the patient becomes, he wants to vomit. At that particular time, ask him or her to expectorate, to give the sputum out. This is the best sample, or the quickest. Fast, brush the teeth. Maybe you have to brush it and then clean it very good in water, because maybe the toothpaste has something against the bacteria. We have to be careful about this. Transport time, you have less than 2 hours. 24-hour in fridge. SBA, sheep blood agar, macaque, and chocolate agar. Because you might have other bacteria, maybe Haemophilus, maybe pneumoniae. They like macaque, they like chocolate. And Gram stain is very important. Here, Gram stain is really important. Why? because gram stain from the sputum directly. So before I can accept the culture, I will do the culture. But before I can accept the culture or reject the culture, I have to do what? Gram stain. White blood cell very high, epithelial very low, then this is accepted. But if it's the other way around, white blood cell very low and epithelial cells, squamous epithelial cells, SEC, SEQ, very high, then I have to reject the sample, repeat the sample, because it's not coming from real sputum. HVS, high vaginal swab for ladies. Usually the doctor, the physician, the technician does not take this sample. It's the gynecologist, women doctor. She or he takes the sample and remove exudate less than 2 hours at room temperature, 24 hours at room temperature storage, blood agar, sheep blood agar, Tire-Martin, TM, Tire-Martin, and there is also MTM, modified Tire-Martin. We'll talk again about these during the course. And we have to do gram stain here also, because you might see intracellular diplococci, Neisseria, in the white blood cells. So you can give an indication that this is it. Also, we have to do not only that, we have to do also wet mount, because in many cases, we found out that the problem is not bacteria, the problem is parasite. And what is the parasite that is mainly found in the genitourinary tract? It's Trichomonas. We'll talk about this in the parasitology course. Trichomonas vaginalis. And I will show you how it moves. It's like a white blood cell, but it moves very fast because it has a tuft of flagella. So gram stain is very important to see if we have intracellular diplococci, which indicates Neisseria, and also sediment, wet mount, to rule out if there is parasite. Plus the culture. Each HVS, high vaginal swab, should be done. Culture, gram stain, and sediment, wet mount. You have to centrifuge and then make a wet mount. These 3 things. I think we have to stop here. And if you have any questions before we go. No questions? Okay. Thank you very much, and see you next time.